Can you see my screen now?
Yes, ma'am. Yes, I can see it on my end.
Okay. Please, is it on presentation mode?
Yes, yes.
Okay. So, I am Zinatuddin Muhammad. Without wasting much of your time, I will go proper into the presentation. Roles of antimicrobial stewardship in curbing antimicrobial resistance. This is an overview of what I will be talking about this evening.
That's
Introduction,
why I want
history
to
of
scan into your
antimicrobial
heart
stewardship.
and we take it.
Antimicrobial stewardship, also known as AMS. Core elements in antimicrobial stewardship. The goals of antimicrobial stewardship. Key strategies for achieving a successful AMS program. Success factors. Roles of antimicrobial stewardship in combating AMR. And then AMS and One Health. Then finally, conclusion. So as a way of introduction, antimicrobial resistance is a high priority area across all countries. I think if it is not really important, you guys will not have established a club and doing the amazing job you are doing right now. So there is a considerable resistance that is commonly attributed to prescribed antibiotics among low and medium income countries in Nigeria and the world at large. And the resistance rate has been increasing continually, which is why even WHO has decided to pick antimicrobial resistance as one of its focus areas. There are concerns about the rising rates of antimicrobial resistance, and the consequences of this have resulted in international and national and local strategies that have been put in place to try to curb this rise in AMR. So national initiatives currently, let's come down to Nigeria and other African countries, include national action plans, which are done under the direction of WHO. And the WHO has decided to put these national action plans for each country as one of its global action plans in order to mitigate antimicrobial resistance. Currently, a lot of countries have national action plans. Even Nigeria has one. And I think our first national action plan was 2019 to 2022. Currently, it has expired and it's undergoing review. I think they have finished the review process and we are waiting for the final copy for 2023, I think to 2027 or so. So history of antimicrobial stewardship. Antimicrobial stewardship implies a process of caring and responsible management of antimicrobial drugs. Historically, antimicrobial stewardship was mostly used in a narrow context. It's not really a new term. It's not really a new process. It has been there for a long time, just that it was not known really as antimicrobial stewardship. During the 1990s and 2000s, programs have been developed and implemented in many countries, mostly by pharmacists in the USA and in the Europe, mostly because of infectious diseases and often headed by pharmacists and other specialists in infectious disease control. Efforts have also existed outside hospitals for many years, but often without being referred to as antimicrobial stewardship. For example, in Sweden, there have been a lot of strategies to mitigate antimicrobial resistance around the 1990s, with a strong emphasis on antimicrobial use in community settings and involving coordination at regional level. Also, there have been efforts in the veterinary sector, where also in 1990s, there were restrictions about the use of growth promoters, which are mostly antimicrobial drugs that are used to promote the growth of livestock like poultry.
Why is all of them married, married, married?
Sorry, I'm having a small challenge here.
Led by
Okay. So antimicrobial stewardship has been conceptualized in many ways, including a set of coordinated interventions. It can be a program, it can be a philosophy, it can be an ethic. So currently what you guys are doing is a part of antimicrobial stewardship by forming clubs, by doing awareness, anything that will lead to interventions or mitigation measures can be classified as antimicrobial stewardship. Antimicrobial stewardship can therefore be defined as coherent set of actions which promote using antimicrobials responsibly. Therefore, these actions may include attempts to directly influence the behavior of prescribers, patients, veterinary professionals, farmers, environmentalists, and I think anybody that has anything to do with the use of antibiotics or antimicrobials generally. For example, we, some people might be doing antimicrobial stewardship in ways that include decision, audit, feedback. So the antimicrobial stewardship doesn't really only entail actions that are carried out in the hospital or healthcare setting. It can also be in a form of like to restrict inappropriate or unnecessary antimicrobial use. For example, selective reporting of susceptibility testing, that's for the people in the lab, like microbiologists, and then restrictions in the use of antimicrobial drugs, that's for doctors and other prescribers. So as we face the progressive extension of multi-resistance among bacteria in veterinary and human medicine, and also in agriculture, there is a need to apply stewardship efficiently in the use of antimicrobial drugs so that we can preserve the ones we have currently and then extend their efficacy also. The term antimicrobial stewardship is encountered in a growing number and increasingly diverse range of contexts. So we can have antimicrobial stewardship programs in the hospitals, in the community, in the veterinary sector, and we currently have an emerging term, which is One Health Antimicrobial Stewardship, and then the WHO Global Stewardship Framework. I will talk more about the One Health Antimicrobial Stewardship in my subsequent slides. So essential elements in antimicrobial stewardship. For antimicrobial stewardship to be really effective, there are some essential steps, I think, which are numbered 1 to 6 here. But it depends on the text or the context you are carrying it, in the context you are taking it. Like, for example, in the hospital sector, it might be different. In the veterinary sector, it might be different. And in the environmental sector, it might also be different. But mainly, these 6 steps are mostly interwoven. And like I said, there is this concept of One Health Antimicrobial Stewardship, which is the best in order to achieve maximum success of antimicrobial stewardship program. So these essential steps or core elements of antimicrobial stewardship include number 1, we have promoting evidence-based prescribing of antimicrobials. Under this context, we also have selection of antimicrobials rationally. There is also need for antimicrobial prescribing and consumption to be for a brief period. In most cases, some doctors will decide to extend your days of taking antibiotics so that the infection is being taken care of totally, but
Khalifa,
this is doing more harm to the system.
522 fa yanzu fa.
So a second step is prescribed antimicrobials after culture and sensitivity report. Mostly when you go to the hospital with any infection, drugs will be prescribed. Some will not even request for laboratory analysis. And even when they request, sometimes you are already on your drugs, maybe 2 days, because when you go to the lab, they will tell you, okay, we cannot take your samples today, or you have to come back next tomorrow. By that time, you have already started taking your antibiotics, and that will really affect the results and the sensitivity report. And in most cases, the cultural sensitivity report is very, very essential in guiding your treatment. So it is a very key element in antimicrobial stewardship. Thirdly, we have ongoing appraisal of antimicrobial resistance and healthcare associated infections. Yes, there should be a mechanism of appraisal. That is to say, monitoring their use, their efficacy, and also monitoring the infections, the trend of infections that are happening in the healthcare system. Secondly, we can also have pharmacovigilance. All these things are in the healthcare sector. Pharmacovigilance initiatives and utilization of antimicrobial resistance. There should be a stringent rule in the use and prescription of antimicrobials in the healthcare settings. There should be also regulatory policies for the sale, the prescribing, and everything that has to do with the use of antimicrobial drugs. Fourthly, educational interventions are very, very necessary. I think educational interventions is one of the programs you guys are doing, which has a very, very long-lasting impact. A lot of people don't even believe that microorganisms become resistant. They only believe that, okay, humans resist the drugs. So these misconceptions need to be cleared out. So educational interventions can be to the prescribers, to the patients, community levels, even the pharmacists. So everybody needs to be educated on antimicrobial resistance and the ways they can contribute in creating antimicrobial resistance. We have to also endorse multidisciplinary collaborative strategy. That is the One Health concept I have been talking about in the previous slide. I don't think the doctors or healthcare settings can achieve antimicrobial resistance mitigation alone. So everybody has a role to play, being in the environmental sector, in the veterinary sector, the farmers, the patients, the healthcare professionals, and you can be surprised that even artists have a role to play. Number 6, we have regular updating, infection prevention and control approaches, and then restraining the source of infection. All these are the healthcare settings, but also at the community level. When we look at our level of sanitation, it has a very, very key role to play in dissemination of antimicrobial resistance. Some of the resistance are not really gotten in the hospital. The environment is very, very key. That is the mixing point where for the microbiologists, they will understand that there can be mutations, gene transfer through various processes in the environment, even before infection. And the environment can also be a source of infection because most of our waste, both solid and liquid waste, are not really treated. And our level of hygiene and sanitation also has a very, very key role to play in dissemination of antimicrobial resistance. So this infection prevention and control is not only for the healthcare settings. What are the goals of antimicrobial stewardship programs? Any antimicrobial stewardship program should ensure that each patient receives the most appropriate treatment, the right drug at the right time, the right dose for the right duration, and also through the right route of delivery. Elimination of antimicrobial overuse and misuse in the healthcare settings, in the veterinary sector, and also in agriculture. We have to also minimize the selection, maintenance, and dissemination of antimicrobial resistance. This can be in the healthcare settings, in the environment, in the veterinary sector, and in all the places that antimicrobial drugs are used. Let's take, for example, pharmaceutical waste. It's also disposed in the environment, which is not really doing well to the environment and the drugs we are disposing. Disposed drugs contribute a lot in the maintenance and dissemination of antimicrobial, even the emergence of antimicrobial resistance. in the environment, which can now be disseminated to humans, animals, and healthcare settings. So key strategies for a successful AMS program, we have one, we have to implement clinical guidelines that take into account local microbiology and susceptibility patterns. We have to also establish formulary restrictions and approval systems that restrict later generations of antibiotics and critically important antimicrobials also to patients where clinical need is justified. So not every infection need drugs. Okay, some will say, okay, I need a very strong drug that will cure this infection. So we have to start from lower generations and move forward to later generations and critically important antimicrobial drugs. In that way, we are minimizing use, duration, and also the abuse of antimicrobial drugs. We have to also review antimicrobial prescribing with intervention and direct feedback to the prescriber. Mostly when drugs are prescribed, most doctors don't even give a follow-up appointment so that they can ask the patient how he's doing, how he has tolerated the drugs, if the infection has gone totally. Some people don't really get um, well when taking the drugs, but they will decide to change hospital or maybe decide to try herbal medicine or go to the pharmacy and tell them, okay, this is the drug they have given me and it's making me feel this way, or it's not working. I have taken it for 3 days. I'm not seeing changes. So please prescribe a stronger one for me. So all these factors need to be put in place to make sure that there are intervention and direct feedback to the prescriber. Also, we have to ensure that the clinical microbiology laboratory uses selective reporting of susceptibility results that is consistent with clinical guidelines. A lot of guidelines are put in place. Mostly the guidelines are reviewed. So each microbiology laboratory needs to be updated on each of these clinical guidelines so that they can report appropriately susceptibility results from their own lab. Success factors. The presence of a motivated team leader for any program, and in this context, antimicrobial stewardship program to be successful, we need a very, very motivated team leader that will motivate everyone and carry everyone along. Also, the team members must be motivated and be ready to share responsibility. Antimicrobial susceptibility, antimicrobial stewardship program is not a one-man job. It's not a one-discipline job. So everyone must be ready to take responsibility responsibly in order to achieve the desired result. Also, antimicrobial stewardship program should be tailored to a local context. We cannot take what is being practiced in the US and bring it to Nigeria or, for example, let's say Sokoto to implement it. We have to look at our own environment, have a baseline data, and know how we can tackle our own situations locally to get desired results. Credibility established by demonstrating early success. Therefore, everyone must be working towards success and then do our jobs the right way so that we can start seeing the success of our programs early. That will motivate us to do more. The roles of antimicrobial stewardship in combating AMR, I think, which is topic that was given for today, but I decided to brush over antimicrobial stewardship generally so that we can understand the roles of antimicrobial stewardship in mitigating AMR. Sorry, I'm having a little challenge with my device. So one of the three tenets of integrated Sorry, please. Okay, so I think I was on.
I think you are breaking, man.
Okay. Please, are you seeing my screen?
Yes, your screen is clear.
Yes,
It's
ma,
your
yes.
screen.
Oh, okay, so the rules of antimicrobial stewardship in combating AMR. One of the three tenets of integrated approach to health system strengthening is antimicrobial resistance. For any health system to be resilient, I think AMS program is one of the key factors that need to be in place. And then the other key factors are IPC, which is infection prevention and control, and medicine, and then patient safety. These three cannot be separated in any healthcare setting. I'm using a healthcare setting because mostly antimicrobial stewardship programs are carried out in hospitals generally, but there is need for them to be extended to other settings like the veterinary sector, the environmental sector, and all. So antimicrobial stewardship programs success in infection prevention and control inclusivity as the individual aspects of an IPC cannot be performed independently. You cannot do infection prevention and control without doing some parts of antimicrobial stewardship program. Even if it is not referred to as antimicrobial stewardship program, you are still doing some core elements of antimicrobial stewardship program. So people in the preventive medicine sector, that's infection preventionists and healthcare epidemiologists, are very, very critical in antimicrobial stewardship programs. For the success of any antimicrobial stewardship program, we need people from infection prevention and control and also epidemiology. The optimization of antimicrobial usage also assists in antimicrobial stewardship. In order to combat antimicrobial resistance when associated with antimicrobial use, surveillance, and the WHO essential medicine. WHO has classified antimicrobial drugs into the access, watch, and reserve group, which are used for various purposes. I think this webinar is not for that, so I will not dive into that. So in combination with antimicrobial resistance surveillance and adequate supply of quality assured medicine, then these three pillars, which are infection prevention and control, patient safety, and antimicrobial stewardship, promote equitable and quality healthcare towards the goal of achieving universal health coverage. So for us to achieve universal health coverage, we have to have an AMS program in place. And then AMS program cannot succeed also without a very, very good antimicrobial resistance surveillance system. And then the availability of good quality medicine. Since its inception, antimicrobial stewardship program has proven highly successful in improving antibiotic use. Yes, because it's been checkmated, even the prescribers are being checkmated, the use in the hospital is checkmated, the pharmacists selling the drugs are also monitored. So it has proven to be very, very successful in improving antimicrobial use. Notably, the 4 Ds of antimicrobial therapy, which are the right dose, the right drug, the escalation to pathogen-directed therapy. That is why we request for laboratory results, because immediately the laboratory results is available, you can de-escalate to a very, very specific treatment. For the start, mostly they start with critical conditions. Broad spectrum antibiotics are being prescribed, but after day 1 to when the results are available, the ideal practice is to de-escalate to a very, very specific, maybe a lower generation antimicrobial drug. And then the right duration of therapy is very, very important. A drug that is supposed to be taken for 5 days should not be extended to 7 or 10 days for the fear of the infection coming back. I think if there are good guidelines to the prescribers, they should be able to know that only 5 days is required for the treatment of the infection, and then education of the patients too, not to exceed those days of taking their drug. And also, we cannot forget infection prevention and control. So these actions are the guiding principles of antimicrobial stewardship program. These strategies are also closely aligned to public health objectives. Mostly, whatever we are doing is because we want to achieve a good public health. And these are not limited to promoting antimicrobial stewardship strategies, monitoring, transparency of data, infrastructure building, and increased knowledge and awareness at the patient and healthcare professional level. All the actions we carry out are tailored to a good public health objective. The next slide will now show us how antimicrobial stewardship programs contribute to this public health objectives, which is the overall goal for carrying out antimicrobial stewardship programs. So antimicrobial stewardship aligns with the 10 essential services of public health. For one, antimicrobial susceptibility patterns and antimicrobial utilization trends are being monitored and also detected at national, state, regional, and community level. There's also surveillance of antimicrobial susceptibility across nations, states, regions, and communities. There's also the provision of information through education, empowerment of our patients, healthcare providers, and other agencies on appropriate antimicrobial use. There is also collaboration with the communities organizations, such as the NGOs and government organizations, geared towards patient safety regionally and nationally. In the hospitals, long-term care facilities, and healthcare systems in promoting antimicrobial stewardship strategies across regions, particularly with shared patient populations. We have to also identify and share best practices and policies in antimicrobial stewardship widely. Antimicrobial stewardship also helps to provide advocacy initiatives for promoting legislation to improve patient safety, reduce exposure, and also develop resistant infections. So there is also advocacy for people to understand that these actions will lead to the development of resistant infections, also how to reduce exposure to these infections, and also how to improve their own safety. AMS also helps us to establish linkages among healthcare entities to enhance antimicrobial stewardship across regions. It also ensures effective antimicrobial stewardship program is established within healthcare facilities, and also we can monitor and evaluate antimicrobial stewardship programs towards improvement of healthcare facilities. There's also the creation of innovative research solutions. These solutions, in order to mitigate the obstacles in antimicrobial stewardship implementation. So these 10 essential services, which are critical to antimicrobial stewardship program, lead to public health, lead to an effective or essential public health service, which can help us in achieving universal health coverage. So AMS and One Health. Antimicrobial stewardship is in the One Health concept is a collaborative, multifaceted, and multidisciplinary approach that engages healthcare leaders, microbiologists, infectious disease specialists, physicians, nurses, farmers, environmentalists, veterinarians, IT experts, farmers, and clinical pharmacists to improve patient treatment outcomes and safety by reducing antimicrobial resistance development. The One Health concept, which is through a multidimensional organizational approach, resulting in the provision of policies, guidance documents, improved surveillance, prevalence and incidence reports, education and audit of practice, internal and external to the healthcare institution, education and training on appropriate antimicrobial prescribing and use, antimicrobial resistance, antimicrobial surveillance principles, or antimicrobial stewardship principles can provide the foundation of knowledge for effective antimicrobial stewardship programs. Therefore, antimicrobial stewardship principles should be taught at undergraduate levels and continue throughout the professional careers by organizing some trainings or thematic programs on these areas. So One Health is very, very important because we all have roles to play in mitigating antimicrobial resistance. For example, in the environmental sector, environmentalists or environmental health officers can be trained in order to carry out surveillance and antimicrobial stewardship programs within the community. For example, even waste treatments, which are used for antimicrobial, for mitigation of antimicrobial resistance, can be very, very well achieved when environmentalists are involved, so that they will know that, okay, we have to take care of this waste in a specific manner, or even our waste treatment plants should take care of residues of antimicrobials. Because currently, I don't think there are even regulations that are put in place to make sure that antimicrobial residues are being taken care of even during waste treatment. In conclusion, antimicrobial stewardship practices, principles, and interventions are critical steps towards containing and mitigating AMR. They are designed to promote, improve, monitor, and evaluate the rational use of antimicrobials to preserve their future effectiveness, along with the promotion and protection of public health. Also, antimicrobial stewardship program has proven highly successful in promoting the rational use of antimicrobials through the implementation of evidence-based interventions. Antimicrobial stewardship principles and core elements are embedded in the WHO Global Action Plan on Antimicrobial Resistance and should be factored in national strategies against antimicrobial resistance. A holistic and multi-sectoral One Health initiative is also needed to address antimicrobial resistance. These are some of the references I consulted for this webinar. And then thank you very much for your attention, and thank you for inviting me to share the little I know about antimicrobial stewardship.